Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
When did nutrition, health, movement, and stress management become alternative medicine?
where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act. Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are going to be talking about a amazing topic today. I mean, aren't they all amazing?
Yes.
But one that is probably near and dear to a lot of our listeners' hearts, because we have a large majority of women listeners.
Mm-hmm.
But before we dive into what we're going to be talking about, we are going to share our weekly Bible verse, and mine is coming from Romans 8:15, and it says, "For you did not receive the spirit of slavery to fall back into fear, but you have received the spirit of adoption as sons, by whom we cry, Abba, Father."
Okay, mine is Matthew 10, 30, and 31. And even the very hairs of your head are all numbered. So don't be afraid. You are worth more than many sparrows. Um, and that is going to lead into our topic today.
That is right. So today we are talking about common causes of hair loss, specifically for women. Um,
Hmm.
and I know that for a lot of women, including myself, I haven't necessarily dealt with hair loss, but I don't have a lot of hair. So I
Hmm.
want to keep the hairs that I do have.
That's yes, that is a common goal that that I hear because there's so much genetics that is in play when it comes to the number of hairs that you have per square
Follicle?
inch or square
Oh, yeah.
centimeter, right? The
Hmm.
number of follicles that you have. And then as well, the health of those follicles, the turnover time of those follicles, like hair growth goes through stages. And so, yeah, a lot of that is determined by genetics. However, lots and lots of ways that we can impact that, both positively and negatively. So, we're going to talk about the common causes of hair loss, but we're also not going to leave you hanging. We are going to talk about what you can do about it too. Um, and so I know Ashley and I both have lots and lots of clients and patients that, this is a huge concern for them. And there are various times in your life where the landscape, like the internal landscape, changes significantly. And I'm talking about, adolescence, perimenopause, menopause, times of great stress, those kinds of things that really can impact hair. The body, when it comes to hair, skin, and nails, these are tissues that are all made of keratin. And especially hair and nails, these are kind of ancillary. They're way way down on the list when it comes to um, the body's triage system, right? So when somebody comes into the ER and they are bleeding out, they're going to take that person back a lot sooner than the dude sitting out with a cough, right?
Yeah.
So the hair and nails are kind of your body's cough. And so if there are other things that are going on, the hair, skin, and nails will often be the very last to come back. They will be the very last to regain health, if you
Yeah.
will. And unfortunately,
Basically, it's like when the body, I mean, whenever you're healing, the body's first mechanism is what's priority, and hair is
Ex
probably
that's
last on the totem
exactly,
pole.
yes, that's exactly right, because, your body doesn't give a crap about, well, reproduction, right? Reproductive hormones. That's why hormones are so wacky when we're stressed. But it also doesn't give a crap about hair. If you are fighting for your life, it doesn't care if it's growing long, luscious locks.
Right.
So, yeah, so that's a problem. But and see, in our culture, though, hair, skin, and nails are very, very important aesthetically to us, and that's why this will absolutely drive women in to talk
Hmm.
to their primary care provider, or, talk to their hairstylist, or talk to their trainer about, hey, what can I do to recover this part of my health? But it's
Yeah.
often a lot more complex than that. So
Hmm.
anyway, yeah, we're gonna dive into some common causes of hair loss. And Ashley, tell me, I've kind of um mention that I have a lot of patients that come and this is their primary cause of concern. Do you hear a lot of this too?
Oh, absolutely. I mean, especially with my nutrition clients that I work with,
Mhm.
that is something that is one of their top priorities is like, I just want well, other than weight loss,
Sure.
they also are looking at aesthetics, right?
Mhm.
So they're like, "Yeah, I don't understand why I'm losing my hair, my nails don't look
Mhm.
crappy. I constantly have to get them done." Which
Yeah.
we did do a episode. It wasn't specifically on nails or hair, but we did do an episode way back in the beginning, of like common signs of if you're have a nutrition deficiency.
Oh, yeah, yeah, yeah. Yeah. Mhm.
I'm gonna pause this real fast.
Okay.
And so, we did that episode, and I think that was really telling because a lot of women do get their nails done. And so
Mhm.
when they do come off, they're like, "Yeah, my nails are just so weak. I need to let
Mhm.
them breathe." And it's like, but it's probably a deeper issue than that. So,
Right.
but I was also going to make a comment too that hair, nails, skin are literally what people see. And so then
Mhm.
that's why we're more conscious of it because we can hide a lot of things that are internal, like
Right.
we can hide our gut issues for the
Mhm.
most part. I mean,
Yeah.
sometimes we can hide our high cholesterol, those types of things. But
Yeah.
if our hair is falling out, if our nails look really crappy, if our skin looks crappy, those
Mhm.
are all things that we're way more conscious of because people can see that.
Exactly. Yeah. No, I completely agree with that. Um so we're going to kind of try to organize this into groups of reasons. And so the first thing I want to start with is hormone balance. So we talk a lot about women's health and just the importance of hormone replacement therapy where it's appropriate in women. And I could tell you that during that perimenopausal phase and then also that menopausal transition, this is a time of great havoc for hair. I mean, it will fall out. Estrogen deficiency in particular will lead to lots of hair loss. But I also want to say there are fertile women within their fertile range here, so we're talking 20s up to early 20s up to like early 40s. They can be dealing with polycystic ovarian syndrome or PCOS, which is
Mhm.
this highly androgen dominant. So we've got estrogen loss that can cause hair loss, but then we also have when a woman's body is in an androgen or testosterone heavy state, then hair loss will happen as well. And it will occur in that like almost male patterning of hair loss. Okay. And then the real cruelty of it is that with an androgen dominant state, they will also develop hairs elsewhere called hirsutism. And
Mm.
that can be like, we all have those errant hairs, right? Like those, like a wiry chin hair here or there that will come back and you just pluck it out. Everybody has weird hairs, but this is more than that.
Mhm.
This is like a lot of unwanted chin hair growth, hair down your neck. um it can even occur on the chest. And the reason you want to really get this taken care of is because hirsutism can become permanent. So this is something that, even if you treat the underlying androgen dominance, sometimes the hirsutism is permanent, and so that would need to be treated with things like laser therapies. They've got all kinds of things they can do with lasers these days. But so that's two causes that involve sex hormones. So the estrogen deficiency and then testosterone excess. But then there is another type of hormone imbalance that we can see that is responsible for hair loss, and that is concerning thyroid hormone. So excess levels of thyroid hormone is often considered Graves' disease or hyperthyroidism. We don't typically see a lot of hair loss with that, but when women have low women, people, everyone, when people have low levels of thyroid hormone or hypothyroidism, and if it's from an autoimmune etiology, it can be called Hashimoto's. Low levels of thyroid hormone can also lead to hair loss, and this is very common. So there are lots of things that I will look at when a woman first comes to me with complaints of hair loss, and running a full thyroid panel is absolutely something that I will do.
Is there certain hair patterns of hair loss that you see, like receding hair
So
or
that's more the androgen. So when you have testosterone that is out of balance, then you see like that male patterning where you see the receding hairline. But things like thyroid dysfunction and estrogen deficiency, those those lead just to thinning, just an
okay.
overall thinning. But it can also, that overall thinning is just so ubiquitous. It belongs in lots of different categories, and we're going to talk next about nutrient deficiencies. All of these present like hair thinning or brittle and breaking.
Mm,
Okay.
yeah.
So and honestly, thyroid dysfunction, hypothyroidism, you will also see that brittle and breaking hair with that as well,
Okay.
because it goes along with dry skin, right?
Mhm.
So dry skin can cause or can actually manifest, because honestly, the skin that we see, like, you look at your arms, you look at your legs, all the skin that's covering your body, this is dead tissue. We're
Yes.
looking at dead tissue. It's keratinized skin cells. So skin cells start out like these little fat cuboidal cells at the dermal surface, and then they gradually migrate to the top. They're pushed up by baby skin cells that are being born underneath, right? And they're constantly turning over. So as those skin cells push their way to the top or get pushed to the top, they flatten out, they lose their cytoplasm, and they become keratinized. So by the time
Mm,
they get to the top, they're quite a good barrier, right? It's a great barrier. It keeps the outside out, it keeps the inside in, but it's highly keratinized. And so if you look at your fingernails, that is all keratin.
okay.
If you look at your hair, it's all keratin. So this is a very specific type of protein that the body makes as a barrier, and then and fortunately we get the aesthetic benefit of it as well.
Yeah, because you see a lot of like keratin products.
Mhm. Yep.
Mhm.
Yep, that's exactly right. So now let's move into nutrient deficiencies, because this is a real area of interest for both Ashley and I. Um
Mhm.
so with women in particular, and especially those who are still cycling, iron deficiency is something that I check for all the time, because with women who have monthly blood loss, and sometimes it's really significant. Again, you might have multiple things going on. Like if I have a woman who has PCOS, she likely is having really heavy menses. And so that is a significant amount of blood and iron loss every month. And iron is a really fussy little molecule. I tell patients this all the time, like it's really hard to get the iron in.
Mm.
It's very difficult. And so I do check for iron deficiency, and I know we've gone over this ad nauseum in this show. So I won't belabor the point, but iron deficiency, even if you have a normal ferritin, which I also run, but if you've got an iron deficiency, you can definitely have hair loss. And there's this now. Most of us, we haven't seen our natural hair color in decades, but for those who have natural hair that has not been colored,
Mm.
there is a banding that can occur on the hair, and that will denote an iron deficiency. So we used to be able to tell a lot easier when women weren't getting their hair colored quite as much as
Right.
we are now. But yeah, there you'll see bands of color, like horizontal bands along the
Oh,
hair,
right. Okay.
and that can clue you into an iron deficiency as well.
All right.
And then Ashley, talk about protein deficiency. Oh my
Oh my
gosh.
gosh.
Hmm.
I mean, this one is so like, it's the low-hanging fruit that you can
Mhm.
literally start with if you don't wanna go get,
Absolutely.
like, any panels done.
Mhm.
You can literally up your protein intake,
Yep.
because, I mean, and specifically collagen, correct? Because
Yeah.
that's gonna be for hair, skin, and nails,
Yep.
joints, all the good things. But,
Mhm.
those are some things that's one nutrient that you all should be
Yeah.
adding in, no
Yeah.
matter if you have hair loss or not. You should be
Mhm.
upping your protein intake because most of you are not eating enough. And go back to our protein episodes on those because we
Yeah.
dive into what you should be doing and how much you should be eating and
Mhm.
all the reasons why.
Yep.
But yeah, protein malnutrition is definitely a one that can cause hair not to want to grow, nails to
Mhm.
look bad. Um, and in that episode that we did on the nails, we were talking about certain like forms of the nail of what how it grows or like the striations.
Mhm.
Was it the striations that was the protein? Like
You
the
know,
linear
it's
lines?
no, it's that can be. That can often be a sign of protein deficiency or iron deficiency. So
Okay.
you've got to run some labs to tease that out often. But there's something called koilonychia where the nails become straight. So if you look at them straight across, like pointing your fingers at your face, you should see like these little the curvature in your
Yeah.
nails.
Okay.
And if they're flat against your fingers, that is often indicative of a protein deficiency.
Okay.
Mhm.
So check your nails, people.
Check your nails.
Mine are
Yeah,
nice and round.
I know. I always try to check nails at my annual physical exams. But again, a lot of women have,
Fake nails.
yeah, they've got all different types of fake nails, and so it's a little more difficult these days. But yeah, you can check that in men, you can check it in kids, in women that don't have artificial nails. Yeah, it's a good check.
Yeah.
Then I also wanted to talk about vitamin D deficiency. This is a big one. Vitamin D deficiency can also lead to some hair loss. Um,
Mm.
I really think this needs to be checked every year. I really, it's not a cheap test, although I will say prices are coming down. There are some there are some more affordable options that are happening with lab testing that I'm looking into for my patients.
Okay.
But yeah, I do think vitamin D is just so critically important for immune
Mm.
function. And gosh, immune function protects us from autoimmunity. It also immune regulation protects us
Mhm.
from autoimmunity. And then vitamin D is also critical for maintaining immune function, which protects us from cancer.
Yes.
So we are throwing off cancer cells constantly, but whether or not they gain a foothold in the body is up to our immune system, and it's how efficacious it is at ferreting out those cells and getting rid of them. So
Yep.
vitamin D is absolutely critical.
I feel like it's gonna be for those that um well, I guess I think it's gonna be one of those miracle supplements. Wasn't it when our
Yeah.
wasn't it on with the episode with Vince Pitstick that he said it shouldn't be called a vitamin D, it should be called something else.
Oh, a
Like a
hormone. It
hormone.
does
Yeah.
right. It does function as a hormone.
Yeah.
Vitamin D, in fact, pretty much any of the fat soluble vitamins, so A, D, E, and K are all fat soluble vitamins, and they're all very hormone-ish in their activity in the body. And so,
Mhm.
hormones have far-ranging physiological targets within the body, and as well they often cause long lasting effects or impact. And so yeah, they do function very much as a hormone.
Okay.
And then the next one, people have heard of this, right? Biotin. Oh my gosh,
Yeah.
it's
I mean,
everywhere.
that's what when you look up any type of hair,
Hmm.
skin, nail growth supplement, it usually always has
Loaded.
biotin.
Loaded with biotin. Yeah, so biotin is it's kind of in the B vitamin category, and you'll find it in all the B complex vitamins, but it also goes by the moniker of vitamin H, and I'm not sure why.
Hmm.
But maybe it's for hair. It probably is.
There you go.
It's probably no more clever than that. But yeah, so biotin, and it is very very integral when it comes to being able to make keratin. It's all about the ability and the willingness of the body to make keratin, right?
Mhm.
And so biotin is a really potent and necessary cofactor. So B vitamins, just as a whole, that particular class of vitamins, they serve as really, really critical cofactors in lots and lots of reactions. In fact, magnesium is the other thing that we supplement with that is a really important cofactor in lots of reactions. So
Mm.
oftentimes it's not the main reactor, but these reactions cannot happen without the proper input of cofactors. And so biotin is for keratin synthesis, it is that really really critical cofactor. So that's why often you can give biotin and people will say, oh gosh, that was such a difference maker. I noticed that like I stopped losing hair, or I'm starting to get this little fuzz around places where I had lost hair.
Mhm.
um so yeah, that's the biotin connection there. So
D Don't we
mhm.
also see a lot of folic acid in hair
Oh, of
supplements?
course, yes, folate for sure. And in fact, that's why uh, sometimes we'll notice that women who are pregnant, right, that they have this luscious hair. Well, how can that be when they've got a baby that is like sucking all of their resources, right? That child is sucking calcium out of their teeth. There are women who will lose teeth during pregnancy, like
Oh my gosh.
yes. Oh, yes, that's a very common thing. And so, yeah, these little buggers, they take everything you've got. So, how is it that the body is growing hair? The reason is because the prenatal vitamins that we give are so loaded with B vitamins like folate and biotin that it causes a lot of lustrous hair growth. So,
There you go.
yeah.
Uh, yeah.
And that's another reason why you'll find a lot of women will continue to take their prenatals even after they've given birth. So,
Yeah.
yeah, yeah, they're good vitamins. And then finally, we've got a zinc deficiency. So, I feel like this is fairly common too, right? Like, zinc has an impact. You can see those little white spots on your nails are
Oh,
generally
yeah.
indicative of a zinc deficiency. Um, but yeah, it can impact your hair too. So you want to make sure that you've got adequate zinc
Okay.
in order to create that keratin.
Perfect.
So let's see the next category that we've got here, and this is a little more nebulous, but so impactful. And I think sometimes people downplay its impact. But stress and trauma.
Uh-huh.
Stress and trauma. So physiological stress can come from completely esoteric events, right? Like how do you quantify stress? Like you can have two people sitting there. They're two people in identical age, identical health, y- uh you know b- state of health, state of nutrition, and then one person is stressed as all get out and the other person is absolutely calm and peaceful, and to look at a snapshot of both of them you'd never be able to tell the difference. So
Right.
how is it that 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 esoteric concept of stress and trauma, how does that translate into physical reality? But it does. You can't separate them.
Well, and I think we've talked about doing even an episode on stress itself
Mhm.
because there's been times in
Yeah.
my life I'm like, am I stressed? I don't know if I'm stressed. Like,
Yes.
and
Yes.
so like I don't know how to recognize stress, and some people don't know how to recognize stress even when they are stressed.
Yeah.
And so it's like kind of going back to your point, how do you measure it? And every
Mhm.
person is so different. So
Yep.
is this when you kind of just start looking at biomarkers?
Well, so yeah, that's a really, really great question. So here's where, and this is very non-scientific, but I
Uh-huh.
But I use it in my practice all the time. It's, I will do a really in-depth clinical interview of someone. I'll ask very pointed questions. Like I get all up in people's business because it all matters, right? I want to know how you grew up. I want to know what was the stress level like. I want to know because all of those things contribute to and we're talking about hair loss today, but they contribute to uh, ongoing health issues. And so
Yeah.
a lot of time we have to revisit that either through counseling or through, um, you know, biofeedback kinds of breathing and that that type of thing can be really, really impactful when it comes to regaining health.
Mhm.
And, the downstream impact of that is that it stops hair loss.
Mhm.
And so, yeah, we've got things like emotional, but also this is a little bit more concrete, but physical stress. And Ashley, I love what you said. I don't know. Am I stressed? I can't tell. Maybe I'm stressed. I don't know. I feel the same. I hear
Yep.
that from people all the time, but I'll start asking deeper questions like, okay, what does your typical day look like? I want you to tell me. Okay, that's a weekend. Now tell me what your typical weekday looks like. And okay, you know, is that how long has that been going on? How many years have you lived in that manner? And how many, what do your relationships look like? How is your on a scale of 1 to 10? Do you feel like you and your partner are in agreement and have each other's backs and all of that, or is it a 2 where you feel like you're kind of at each other right now? How do all these things look? And so a lot of times I can get the information from somebody that's telling me, no, I'm not stressed at all. No, my stress is a 1. I don't have any stress. But then I start digging in and it's like, whew, you got a lot of stress. The fact that you don't recognize it is also very telling, right?
Yeah.
so,
Yeah.
yeah, so emotional stress, also physical stress. So
Mm.
you probably see this more than I do, but I do see it where women are just absolutely flogging themselves with
Yeah.
exercise and not supporting themselves with adequate nutrition. And
Yep.
so when we have those folks, often hair loss is a piece of the puzzle too.
Mhm. Yes,
Um,
absolutely.
and then we've got things like real physical trauma to the body, this acute physical trauma of surgery. This is
Yep.
a big deal, and
Mhm.
if it's a big enough or impactful enough surgery, yeah, people will lose hair.
Well, I
Um,
mean, going back to the body's mechanism, it's
right.
only one mechanism is for
Mhm.
survival, and your hair is not meant for survival.
That's exactly right. Yeah, because your body, it doesn't know that somebody wasn't trying to hack you up and kill you.
Exactly.
That's a majorly stressful event.
Mhm.
So here you lose consciousness, you wake up and you're hacked open. And so it's got to go through the healing phase of that, and there's trauma that goes along with that. Now there's
Absolutely.
also and we've talked so major life events, things like divorce, things like moving.
Mhm.
Moving is intensely stressful.
Yes.
Um for so many reasons, even if it's a happy move,
Yep.
it is still intensely stressful and can cause you to lose hair.
Yep.
Now, I also want to talk about something a little more physical, which is a heavy metal toxicity. So, for instance, if you are, this probably should have gone with nutrient deficiencies in that realm, but if you, for instance, are on well water, you really should get your well water checked. There are
Mm.
things like uranium that can seep in. There's arsenic. There's lead. There are lots and lots of metals that can be responsible for some different types of hair anomalies. Um, and so the next thing that I want to talk about is infectious disease. Okay, and we all went through the last 5 years with COVID.
Yes. Yep.
And I have told people this for years, but COVID makes hair jump off your head. There is something unique about this particular post-viral sequelae, of which massive hair loss is a part. And it's 2 to 3 months after you were sick. And
Mhm.
so nowadays it's a little less easy to identify because, you know, in years prior, I've been able to say, okay, when was the last time you had COVID? And this is when we were all testing constantly and knew when we had COVID. But now it's like, it's part of our normal viral uh, impact every
Right.
year.
Yeah.
You get COVID, you get over it, and you move on.
Right.
And we don't really test for it anymore. Unless you're seriously ill and end up in the hospital or urgent care, and then we can test.
Right.
But yeah, invariably, if I had somebody with sudden onset hair loss and it was pretty profound, I would say, "Hey, when was the last time you had COVID?" And it was like, sure enough, 60 to 90 days ago, I had a round of COVID, and it doesn't even have to be bad COVID. It could be like, yeah, I tested positive, but it wasn't a big deal. And then your hair jumps off your head. There are women that lost the majority of their hair post COVID.
Yeah. I know several people that
Mhm.
experienced that,
Yeah.
and it's a
Yeah.
real thing.
Yeah, and so what we saw with COVID was there was this febrile component to it, meaning that the body revved up its temperature, and so you notice a fever that comes along with. So also other febrile illnesses, you can have hair loss, but honestly, I have not seen hair loss like we saw with COVID. I have never seen that before from any kind of febrile illness that I am familiar with. So that post viral hair jumping off your head has a fancy name. It's called telogen effluvium. And you can actually apply this to, like, if you had a major, major life event, stress, if you went through a divorce, if the death of a family member, that kind of thing. Um, Telogen effluvium can also occur at that time. But we saw a ton of it with COVID. And essentially, this is just diffuse but temporary shedding of, like, nearly all your hair. So, and honestly, you guys, there really isn't much that can be done. You
Yeah,
just have to get through it. Now, I do think the state of your health before you go into COVID and the subsequent hair loss, that matters. So you want
I
to keep
agree.
yourself as healthy as possible.
And we know that a lot of people that do get these viruses, specifically COVID, are typically vitamin D deficient
Mhm.
and usually have a zinc deficiency.
That's right.
So
That's right. Yes.
up
N
up
it
those
all
two, it
Yeah,
all
it all
circles
makes
back.
sense. Just don't eat like a butthead. It just there's just not the gosh, it just solves so many problems if
Yeah,
you just eat well.
yeah.
Um,
Take your cod
s
liver oil.
That's right, that's right. Oh, yeah, vitamin A is critical, yeah. No,
Mm.
vitamin cod liver oil, again, it will cure what ails you, so big fan. Um, alright, so now let's talk a little bit about autoimmunity because,
Yeah.
there are patterns of hair loss that are associated with autoimmunity. So there's an autoimmune disease called alopecia areata, and this is where the body it will go after various hair follicles. So we all know that autoimmunity is where the body attacks its own tissues. So there are
Mhm.
various tissues within the body. Like, for instance, if it attacks the oh gosh, the neuromotor junctions, then we could be looking at like an MS or something like that. If it attacks the joints, we can be looking at various forms of rheumatic arthritis. But if it attacks the hair follicles, then typically we're talking about an alopecia areata.
Mm.
So this is a non-scarring hair loss, but it can be a complete and total hair loss. Eyebrows, hair on arms, hair,
Mhm.
it's a global phenomenon. Um, and this is something that we want to go after by all the things we know to do with autoimmunity in general. And if you're curious about that, please go back to almost the beginning of our show. Didn't we
Yes. Yep.
do that right at
I
the
think
beginning?
I think it was episodes 3, 4, 5, 2, 3,
Yeah.
4, 5, something like that. Yep.
Yeah, way back at the beginning. All of that still holds true. We do have some advancements. We might need to do an updated autoimmune podcast, but I do think throughout the body of our work we've addressed autoimmunity at various times. So anyway, yeah, then so there's alopecia areata. Um, for which you can eat all the protein in the world and it's not going to give you your hair back.
So do
Unless
we know why that one happens? And do we have anything or have you seen anything that's kind of helped it?
Well, sure. Get off the gluten, control the inflammation,
Mhm.
those kinds of things. Now we are using things like low dose naltrexone as an
Yeah.
immunomodulator.
Yep.
We're using gosh, I've got peptides in my arsenal that I can advise people on when it comes to autoimmunity as well. So yeah, there are some things that can be done for that, but you know that my take on autoimmunity is I don't separate it by body system. It
No.
is all part of the body attacking self tissue and
Yep.
not being able to recognize the self from non-self, right?
Mhm.
And so it is an aberrant functioning of the immune system, and I don't separate it out by body system
Yeah.
like conventional practice does. So yeah, I also want to acknowledge celiac disease because that can
Mm.
lead to some
Yes.
significant hair loss. Um, I unfortunately there are probably quite a few people walking around with true celiac that don't know it,
Mhm.
and they've got weird symptoms that aren't associated really even with the gut so much as these global symptoms. In fact, there are symptoms of celiac that mimic POTS, right?
Mm.
This the postural orthostatic tachycardic syndrome, where people will have like dizziness or episodes of hypoglycemia
Mhm.
that are celiac disease.
Mhm.
In fact, there is a form of gluten sensitive. There's a form of gluten allergy that masquerades as schizophrenia. It's a gluten-induced encephalopathy, which is crazy. That's crazy. You get the gluten out and they get their minds back.
Oh my
And
gosh.
so yeah, so here's where I know the conventional world looks at us in functional medicines and sometimes they think that, we're kind of a one-trick pony. Like gluten-free, go gluten-free. You should not be eating gluten. And I understand that. However, let me just tell you if that's where your mindset is, I just want to present this. What is the harm in taking out gluten for 40 days? There
Mm.
is no harm. There is no nutritional value that humans derive from gluten. And so this argument that we're getting rid of a whole section of food and this is not nutritionally sound, bullcrap. There is not one nutritional redeeming value to gluten. There just isn't. Um, Now, does it hurt everyone? No, it doesn't. It doesn't. But it is absolutely clinically sound to remove gluten for 40 days. If you're beating your head against a wall and you cannot find the genesis or the origin of a set of symptoms that your patient is experiencing, get the gluten out for 40 days and see if it does any good.
And why 40 and not 30?
Because of the half-life of the antibodies that are created against gluten. So you've got IgG, IgM, IgE. You've got all of these antibodies that with which the immune system um, makes in response to the foreign body or the gluten or whatever else. And so you want to clear all of those antibodies. So based on antibody half-life, um, I always tell patients 40, 45 days that it's got to be. It's got to
Yeah.
be. Because if you stop before then, it muddies the data and you won't get good data. um so yeah, and there's literally no downside to
Yep.
removing gluten. It
Yep.
is a completely benign intervention. And my gosh, in the medical world, if you've got a completely benign intervention that can have significant positive impacts, there's no reason not to do it.
Yep. Absolutely.
So I will get off my soapbox now. I got a little serious about that.
Andrea is very
Mhm.
passionate about her gluten,
I
especially when
am.
it comes to autoimmunities.
Yeah, that's right.
Yeah.
That's right. Okay, so now we're gonna jump into another section where why do we experience hair loss? Well, medications and treatments. Holy moly. Okay, so the number one with a bullet, you guys, number one are these GLP-1s.
And do you find, or do you have a suspicion? I don't know if we have any actual data on this, but do you find that with the GLP-1s and even probably some of these other ones that are listed, it suppresses appetite.
Mhm.
So then
Oh,
therefore
sure.
you're
Yeah.
nutrient deficient.
Yeah. Yeah. No, I think no, and that's very astute, Ashley. I think that is the whole reason. That's the whole reason. Because here's the thing, like
Because if you go back to, we have a series on GLP-1s.
mhm.
We are not haters of this. I
Mm-mm.
think we think it can be an amazing tool to be
Right.
used, but it needs
Right.
to be used very smartly with
Mhm.
somebody that can use it properly and not
Right.
just chase how many pounds you can lose in X many months.
That's right.
Um, we think it's an amazing tool to use for those struggling with um, a lot of things,
Yeah.
but
Yeah.
specifically, n not being able to lose weight. But
Mhm.
going back to our topic of hair loss,
Mhm. Mhm.
yeah, I mean, you have no appetite now, you're not eating, and when you do eat, it's probably very little, you're eating like a rabbit,
Yep.
and then you're more than likely not prioritizing protein,
Mhm.
you're not prioritizing nutritional things because I mean, I'm just kinda getting into the psychologicals of this, but it's
Mhm.
like, well, I don't eat that much, so I'll just have whatever I want now.
That is precisely it. People will eat what's palatable because again, the way that GLP-1s work psychologically, we are not privy to. We don't know
Yeah.
exactly what type of impact this is having on the reward system, but there it sort of removes the dopamine hit that you get from
Yes.
eating food. And so
Mhm.
uh
Absolutely. I
it
hear this all the time.
yeah, yeah, and again, we don't know how that works,
Mhm.
but in order to gain, pleasure from eating food, people will go after more and more highly palatable things, like, I have oh my gosh, my husband worked with someone who was on a GLP-1, and she would literally exist on these little packets of candy,
Mm.
like M&Ms, like Red Hots, like, hot tamales, because they were highly palatable, and she could still get a little bit of that dopamine hit or that pleasure from eating the food, but she would eat tiny little packs of them, so she thought she was being, like, really, really, self-disciplined,
Right.
but that's all she's eating. And so
Exactly.
was she losing weight? Yeah, but she looked like a melted candle
Yeah.
because she lost her muscle, she lost her hair. Like she completely lost the ability to have a ponytail because there just
Mm.
wasn't enough hair.
Yeah.
And it's just
And
sad.
so going back to, even
Mhm.
go back to those episodes that we did on him because they have really valuable information if you are considering or are currently on a GLP-1,
Yeah.
not only for this hair loss
Mhm.
situation, but not to look like a melted candle. I can
Yep.
pretty much pinpoint somebody who is on a GLP-1.
Yep. Who
They
is not working with someone and
who is
doing it
now
right. Yep.
exactly. So
Yep.
if you and the thing that's sad, and it is sad to me because you want these wins of these people who have
Mhm.
struggled multiple decades usually with not being able to lose weight, and
Right.
they're now seeing these wins and they're hearing this from somebody like you and me
Mhm.
saying but do it better. And they're like,
Right.
"Well, this is finally working. Like,
Right. Right.
I'm finally losing weight." And it's just like, "Yeah, but we can see
Yeah.
clearly that in 5 years, 10 years, you are gonna have 0 muscle mass. You are
Mhm.
gonna have other health issues
Yeah.
because the weight was one to begin with, but now you've basically caused a whole cascade of other issues because
Right.
you haven't done it correctly by making sure that you're eating protein, make sure you're eating nutritionally, make sure that you're exercising and trying to maintain as much lean muscle mass as possible." So I
Yeah.
will get off my high
Mhm.
horse
Yeah.
soapbox.
Preach, preach, baby. Yeah, it's and God help you if you're over 40 or 50 and you've lost that muscle mass.
Yep.
It is so difficult to put it back on.
Yes.
It's intensely hard.
And that's why I think the GLP-1s can be an amazing tool if you're
Mhm.
using them properly, even at the age over the age of 40 or 50, because
Yep.
you can use this as a tool to assist you with those urges that you might have already had
Mhm.
that is causing those weight loss issues. And then you can couple it's like habit stacking, right?
Right.
Where
Yep.
we're going to use a GLP-1 as a habit, and then we can stack it with, okay, now we're going to have 3 or 4 balanced meals during the day that are protein focused.
Yep.
And so you can start habit stacking when you have these GLP-1s in
Mhm.
your life.
Yep. Absolutely. Totally agree. Totally agree.
Yes.
Okay, so now, that's the hit on GLP-1s. The next one is real quick, it's chemotherapy, okay?
Yeah.
So, chemotherapy targets fast-growing tissue. That's why, we get things like mucositis where, like, the whole mucosa of the throat and mouth can slough off.
Mm,
Hair is lost. Tumors are fast-growing sets of cells that are rapidly turning over, and so
mhm,
i- a lot of a lot of traditional chemotherapeutic agents will target those fast growing cellular cycles, and so
mhm,
hair is among those. So
yeah.
chemotherapy, also antidepressants. There are a lot of antidepressants that are really can cause some significant hair loss, and a-
But a lot of
again.
antidepressants have a appetite suppressant as a side effect, correct?
No, no, no. A lot of antidepressants will cause some pretty significant weight gain.
Oh, really?
Yeah. Yeah. If it so there are different medications for different forms of depression. And yes, there are some atypical antidepressants, but you wouldn't see them very often.
Mm,
In fact, there are whole categories of typically used antidepressant medications that go in order of least to most weight gain.
okay.
So yeah, it can cause some really significant weight gain, but can also cause some hair loss. So
Mm,
yeah, great on all fronts.
right?
Yeah. Now there are stimulant medications that are sometimes used for depression. Now those can absolutely cause you to lose your appetite. Things like ADHD meds, things like yeah, antipsychotics for like schizophrenia, those would cause significant weight gain as well. Um, but like Vyvanse, Ritalin, Adderall, all of those can remove your appetite, and we use those sometimes for binge eating disorder as well. So yeah, they remove appetite. Um, but I yeah, I have mixed feelings on on the antidepressants. I use them in patients and usually for short periods of time until we can get them to a place where they can safely wean off.
Mhm.
um but often these folks, if they're really struggling, um sometimes they can't muster the energy to even go feed themselves, right?
Right. Yeah.
And so that's a problem too. And so I would much rather use the antidepressant than deal with suicidality down the line.
Mhm.
Now, some of
Mhm.
these things can cause some increase in suicidality depending on the population in which they're used. So it's just it's a real mixed bag with antidepressants, but for the purposes of this podcast, they absolutely can cause some hair loss. So next category, retinoids. So one of the most famous retinoids is called Accutane.
Ah.
So Accutane it can cause a premature ejecting of the hair from the follicle. And so when you consider, and this actually kind of makes sense, right? Because when you consider what retinoids do, um, think about the side effects. I don't know if you've ever known anyone on Accutane. Have you? You have any
I
experience
think
with
back
that?
in the day, like
Right.
when I was little, so I probably don't have any recollection of any side effects.
Okay. Let me tell you, people who are on Accutane, their skin dries out.
Oh,
It's
I
a
do remember
vitamin
that.
A analog, okay?
Okay.
But it's really, really potent. And so their skin will dry out so completely. They have to use eye drops. They have to use constant chapstick, and even so, even with the lip balm on, their lips just crack and peel, and it is horrendous. Now, think about what that does to a hair follicle, right? I mean,
Mhm.
it's no surprise that the follicle is impacted because it's right there in the dermal layer.
Mhm.
Um so yeah, retinoids, now even topical retinoids can cause some hair loss. So if women and women are using retinoids, actually men are using retinoids now too, because they will help with fine lines and wrinkles. And apparently this is like the dermatological mainstay. You always, always, always want to use a retinoid. And this is what I hear from dermatology, is that retinoids are the mainstay of anti-aging therapy. I don't use one myself. I kind of go on and off of a retinoid. I can't do anything for a really long period of time because my attention span is very short. So, but apparently retinoids are the thing when it comes to fine lines and wrinkles, which I probably should be availing myself more of retinoids. But then also there's a very common, not as common as it used to be, but beta blockers. Okay. So we used to use beta blockers as control for hypertension or elevated blood pressure, right? We have much, much, much better drugs now. We still do use beta blockers for like post MI, although the research on that is changing as well. I just read some new data about that. But yeah, beta blockers, these are going to end in olol. So these are drugs like propranolol, atenolol, timolol. There's lots of them, but yeah, the beta blockers, will use them for anxiety. I've got patients that I'll use this for anxiety. I'll use beta blockers for oh boy, they're stage fright.
Mm.
I will use it for people who have problems getting on an airplane. So they've got a lot of interesting uses now, but oh, migraine prophylaxis. I use them for
Mm.
that too. But they can cause some hair loss. So,
Okay.
let's see. And that's pretty that's a pretty good overview, I think, of the medications that can cause hair loss. But talk to your primary care provider. Like if you're having hair loss, have them go through your med list with you and supplement list as well, and see if there's any red flags in there.
Yeah.
Um, Now, mechanical and lifestyle. So this is kind of obvious, and most women probably are aware of this, but in case not, there's something called retraction alopecia. And so for those of us that wear our hair in a ponytail nearly every day of our whole entire lives, um, traction, that pulling of the hair, you want to, if you wear a high tight ponytail, you want to be real careful and loosen that sucker up. I also sleep with my hair like piled up on top of my head because it's so long. I can't, I drown in it at night, and so I have to have it piled up on top. um so you want to be really careful because pulling the hair tight can cause that follicle to die, and it will
Mhm.
spit out the hair. Okay.
Yeah.
Also, over processing, frequent heat styling can cause thinning and breakage, that kind of thing. Low calorie diets, we've already talked about.
Hmm.
So yeah.
Well,
So I'm wondering if we should make a part two for the for the cure.
I think so. Yeah,
Okay.
let's do a part 2 because that would actually
This
be perfect.
yeah, this
Um,
took longer than I thought. It always
yeah,
does.
but this is fascinating. I mean, a lot of these things I think a lot of us probably are maybe subconsciously or consciously aware
Mm,
of, but
mhm.
just having it in a concise format of like, oh yeah, these are all things um that can be contributing to potentially my hair loss or hair thinning.
Right. Right.
But there are, and we're going to get more in depth on this into the next episode. There are some really low hanging fruits that you can
Yep.
start at.
Yep.
You're more than likely not dying of cancer.
Mhm. That's right.
um, so we can start with some low hanging fruits that you can start right away.
Mhm.
That
Mhm.
probably cost you pennies, if not any more money.
Yep.
And then getting into, some even uh, lifestyle type things as well that we can go over as well. So no,
Yep.
I think that this was really really good, and I know um, for myself too, like have struggled with always having thin hair, stringy hair, and over the years, it's not perfect by any means. And if you see me and you're like, yeah, your hair is kind of actually nasty, um,
Ah,
n-
no, it isn't. No,
like
you have thin hair.
yeah,
It's you have you. So there are two types of thin hair. You can either have an actual hair shaft that is thin, or you can have a fewer number of follicles per like square centimeter of space. Does that make
yeah,
sense?
yeah,
Yeah. So, and also as you get older, and as the keratin and the melanin change, so the coloring of your hair also changes. So as it gets more gray, the hair itself becomes thicker
hmm,
and more wiry, right? Like
yeah,
gray hair is actually a whole lot easier to style and has a lot more body to it, and volume to it because it's thicker.
yeah.
So, yeah.
That's true. So
Yeah.
maybe
So
maybe when
you're
I'm
good.
60, I'll have nice
That
luscious hair.
Oh my gosh.
Ah.
No, I can tell you, and we'll get into this more on the next one, but my hair has never been this long in my entire life. I just got it cut just a couple of months ago, and I'm tucking it into the back of my pants again. Yeah, and Ashley and I, okay, I'll just make this announcement now. Ashley and I, we are trialing some new collagen, you guys. So, we
Yes.
may have a recommendation for you next time.
Yes.
There's a company I'm super eager to try their collagen. I just got my order in the mail, and so we will let you know what we think of it, and we'll put this on our next solutions episode.
Yes.
But yeah, I'm really excited about this company. It's been a while since I've been able to recommend a collagen. I've been trying lots of different kinds and have been sadly disappointed with their ability to dissolve, their palatability. Honestly, collagen should be dissolvable and it should not taste like anything. It shouldn't
Mhm.
detract from the thing that you're drinking, just because it makes compliance hard when you don't want to drink what you're drinking. So,
Exactly.
yeah, so we'll be in touch about that. Stay
Yes,
tuned.
absolutely. So if you listen to this episode and you're like, "Hey, I have questions. I want, or I've been doing XYZ. What do you think about
Hmm.
this?" Let us know. Hit us up. We have all our contact information in the show notes below. But until then, we will catch you on the next episode.
Bye. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.